Hi guys, welcome. My name is Diego,
My name is Chloe.
and we both work with Chicago EMT Training. Today we're going to be talking about kind of navigating our way through pre-med and pre-PA, and coming up with a decision for which route we want to take.
Yep. Do you kind of want to talk about what made you want to start the pre-med track?
Yeah, so for me at least, when my initial kind of exposure to pre-med or just like the healthcare field was when I was very young, when I was like roughly about 11, and I was playing with my two younger brothers, and my middle brother and we were swinging around our younger brother, and we kind of, all jokes, but we let him go, and then he slid across the floor and he hit his head on the corner of a wall. And then that caused him to just have like a solid laceration on his head. He was bleeding. And I was like, Mom, like my younger brother, he's bleeding. And like we went to the hospital. I was super nervous, but my mom was like kind of frantic. My middle brother was like crying because like my brother's perception was like, oh my gosh, she's gonna die. And at first I was like, oh my God, did I like just kill my younger brother? And and essentially, like, I don't know, I kind of like was like one to comfort and like be there, hold, like applying that pressure to my younger brother's head, like calming him down, and then calming down my other brother, because my mom was like in a frantic state. Got to the hospital, and like the doctors were just like so assuring. They're like, they just like hyped me up. They're like, thank you for being so strong, this and that. And I was like, man, like I want to be you.
Wait, I'm kind of good at this.
I know, but like I was like, I want to be you one day. And then after that, it was just kind of like positive affirmations. I enjoy the sciences. In school, I was able to do anatomy. And from there, I was like, I'm really interested in this. I can definitely see myself kind of like have a career in medicine. And that's kind of what led me to apply as like a biology major. And yeah, like that's kind of my initial story of diving into and choosing pre-med thus far.
Nice.
Yeah. How about you?
Mine was the opposite. I knew from like third grade until freshman year of high school that I wanted nothing to do with healthcare. I remember I sprained my knee once in like third grade, and when we went to the hospital, I had more anxiety about hearing people like throwing up or seeing blood. I was freaking out.
Yeah.
If the door wasn't closed all the way, I would like start screaming. I was in third grade. It wasn't like I was 7. And then honestly, I started watching medical shows when I was in middle school. And I know that sounds very cliche, but if you think about it, if you don't come from a family with doctors in the family or nurses or anyone in healthcare, both of my parents were in law, you don't really have that exposure. So I think the TV shows were my first exposure. And then I started, volunteering at my local hospital in high school. I did our like medical careers program. So my senior year of high school, I would leave a couple hours early to go shadow like physicians, physical therapists, in our town. And that was kind of what made me realize, maybe I want to do this. I think my initial problem was I viewed healthcare as doctors and nurses and nothing else.
Yeah.
It was either if you want to be in the patient care world, you're going to be a nurse or you're going to be a doctor. So I just had to pick between the two in that aspect. And so I picked doctor.
Yeah, makes sense. I'm not going to lie. I definitely watched the Grey's Anatomy,
Yes.
And I was like, I'm going to be Christina Yang.
Absolutely. How could you not?
Yeah. So I definitely relate on that
Yeah.
regard.
And then we got to
Cool.
college.
And then we got to college.
And Diego and I met on our very first day of freshman year.
Yes.
Our not even
like a
orientation,
week before.
the week before when we moved in. We sat next to each other at Giordano's.
Yes.
And Diego smuggled some pizza home, and I was like, you know what? We're gonna be friends. We are gonna be friends.
Great friends.
Yes.
Great friends.
And I kind of think it helped that we both knew we wanted to do pre-med. We kind of like molded into each other, and we became like a support system for each other. Yeah.
Yes.
So we took our basic classes, our pre-med recs, and then it came to time when we had to figure out what to do for clinical experience. And that was when you mentioned the EMT program during the pandemic.
Yeah. So I think freshman year, just to talk about it a little bit, or like just going into freshman year, we both kind of had an idea of like, all right, we need to kind of be on top of our stuff if we want to pursue just like our pre-med, just to be competitive. So I feel like you and I kind of at like similar things. Like you, actually, I can't speak for you, but but for me at least, I was like, all right, I know that I have to get like myself out there. And I think you mentioned volunteering when I was like hearing some of your backstory and like why you're pre-med. And I was like, I should definitely do volunteering. So I started volunteering at Rush. And I kind of did that my freshman year, consistently every week, as well as just like kind of like just get acclimated to school just to make sure like I'm like on my grades, everything's good, as well as like kind of enjoying and dabbling in extracurriculars.
Yeah.
What did you do freshman year? I can't
Same thing, yeah. Just volunteering, joining clubs. That was the year that we were just really trying to like make our own name at school and find like that friend group. And that was more just about settling in. So I wasn't as focused on, oh my gosh, what do I need to do to make this application great? It was, what do I need to do to make myself stay afloat here? And like we're taking hard classes. We're in like a completely different social situation. We're living in a dorm for the first time. So it was kind of just acclimating to everything. And then once we got our footing that like spring of freshman year, we were like, which was COVID, by the way.
Yes. Yeah. So we got our footing. Spring of freshman year. And we're like, all right, we got this. And then
we didn't.
And then spring break comes.
Yeah.
And we're like, well, like, what are we going to do?
Longest spring break ever.
They essentially moved classes online, COVID hit, stuff like that. But Chloe and I kind of had two different, like, thoughts, I feel. So, like, I was like, oh, like, let's do, like, I know we have to do clinical work just because we've done our research on, like, what makes a competitive applicant. I was like, oh, like, we should take this EMT class that UIC offers. And at the same time, I think you brought up the idea, like, oh, we should also take Physics 1 and 2 online just because we can do, like, we have the time during our summer. And that's kind of like how we then started like being more progressive on like being more of a competitive applicant, especially during the time of COVID, because there was so much uncertainty. Like we didn't know, like we had our plans and then it kind of like fell through.
I know originally I was trying to scribe. I was trying to get into scribing. And then as I was in the interview process, they were like, we have to shut it down. Like we can't have any extra people in the hospitals. So then you mentioned EMT and I grew up with a dad who still is diabetic. And I remember whenever he would, have sugar problems and like the paramedics from my town came, they were like superheroes. So I didn't realize being an EMT was something you could just do in like 3 or 4 months over the summer in an accelerated course. Like I didn't know I could do that. I thought it was something you had to kind of be out of college to do. So when Diego brought that up, I was so excited and we applied. And we
took the class.
We did it. It was a lot of balancing, but it was possible to be able to kind of have to go to physics in the morning and then drive into the city and go to our EMT labs. But I feel like if you have a good schedule, if you have good balance, you're able to handle. I mean, there's 24 hours in a day, which people always say, oh, there's only 24. But you kind of have to look at it. We have 24 hours. That's a lot of time. You can do a lot of things.
Exactly.
Yeah.
So... I mean, we both did EMT and then we kind of went into our sophomore year. And then we kind of like, we're still great friends, but I feel like we kind of in a way started doing a little bit more of
we became our own
things.
people.
Yes. Yeah. Because we were like so connected with one each other and then we be like, which includes like research. We did different research.
We started doing the same research.
But didn't you start at Stroger?
Yeah, that's
first?
True. Yeah.
And then I started at Rush, but in the orthopedic department.
Yeah.
And then, like that November, we then did the same research for the Inspire study.
Yeah.
But then again, like you were also involved in like different extracurriculars than I was. Like I was in volleyball, you were in Delta Epsilon Mu, and I was like, so there was a bit of.
Yeah. I joined a sorority too.
Yes.
Which again, that's something I love talking about when I talk about being pre-med. I feel like a lot of people are they feel isolated to certain categories when it comes to like extracurriculars and clubs. But you got to remember you're joining stuff because you want to, not because you have to.
Exactly.
So at the end of the day, yeah, sure, something's going to look good on an application, but are you passionate about it? Are you able to talk about how it changed you, how it helped you, how it formed you as a person? And I think that's what matters more is if you have those experiences.
Exactly. So, like, I feel like we were talking about like just looking at what makes like a good or a strong applicant, but at the same time, like, yes, we were kind of like checking off the list, but we were also doing it for the reason, like we could have gone another route. We could have done CNA, we could have done scribing. But I feel like EMT, like it was just a way to be more personable with people and a way to kind of be out there on the ambulance. And I thought it was like, I was very interested in it, and then you became very interested in it too. So it was doing it for the right reason, not just because we had to check off like the list. Even though we knew like we had to do the hours, we could have gone another way, but EMT was just the most attractive, and I feel like, at least in my point in time, I got the most out of being an EMT.
Yeah. I think it really forces you to be on your own.
Absolutely.
You know, being in the pre-hospital setting. We worked during school. We both started working at a private ambulance company and then for an event company. We were able to manage that. I know one of the semesters, my junior, senior year, I worked full-time nights on the ambulance and then went to school full-time and then had all the extracurriculars too. So definitely took a lot of balance, but it's very possible.
I worked part-time, and then with volleyball, I couldn't work full-time or kind of, I'd have to sometimes call off for the job that I was working, just because we'd have like 2-day tournaments over the weekend, or just conflicts that I would have to attend to. So when we both worked during school, we both were full-time students, and then we were also doing research, doing a lot.
It's possible.
It's definitely possible.
And then came flash forward. Now it's like, well, we have to apply.
Yes.
And you and I were both pretty set on taking at least one gap year.
Yes.
I feel like we were in that mindset. And it turned into 2 just because senior year got so busy, too busy to study for the MCAT. I tried to work full time, do all my stuff, and study for the MCAT. And that's when I hit that cut where I was like, that's not going to be good for me. And eventually, like, good for my mental health and my relationships, my friendships. So
exactly.
Yeah.
For me, I definitely knew I wanted to do 2 gap years, just because for school, like, I was taking like 18 credit hours just because I was doing a double degree, and I was like, I need to definitely have a little break. Yeah. For sure, at least 1 year to take the MCAT. Yeah. But before even like kind of looking at pre-med and pre-PA again, I think in between, like as we were doing our undergrad, we were also kind of debating like pre-med and pre-PA back and forth, just because we got to learn a little bit more about like the role of a PA. And we're like, oh, this could be like a great route to take, but we still don't know. Yeah. And
well, like I was saying before, it's like I only thought of healthcare as doctors and nurses.
Exactly.
And then when we became EMTs, you're dropping off at these hospitals. I remember very specifically the experience where I realized healthcare is so much more was taking like a trauma transfer out from a smaller hospital into a large level 1 trauma center in the city. And when we dropped off the patient, there's airway, there's respiratory sitting at the head, there's the PAs, there's the advanced, what are they? The nurses, the APNs. Oh, APNs. Then you have like the surgeons and the physicians and there's everybody. There's so many people. Roles, so many people on a healthcare team. And then that's when I was like, wait a minute, like, how do I know that I'm picking the right path? Like, what are all these people doing? What are their roles? What do their careers look like? And I feel like it also comes with, as you're getting older, your priorities kind of shift a little bit. Absolutely. So I know personally what made me kind of want to switch was when you look at the schooling between like MD and DO versus PA. It's like, are you going to commit to 4 years of medical school and then who knows how long residency based on what specialty you choose, or you have usually like a 24-month program for PA followed by a residency if you choose, which aren't very common. They're kind of increasing in popularity now. And then you go straight into working and making your living when you're younger. So I think that's something you also have to think about too, is what you want to commit to.
Absolutely. And I think for me during undergrad as well, just to bring up this topic, I kind of was in a point where I was like, okay, like I need to reflect. Why am I choosing medicine? Like, why do I want to be, or why do I want to pursue an MD or DO? And for me, I thought one of the ways I could answer that question was by shadowing all the other like different roles in a hospital. So I shadowed like a PT, I shadowed physicians, I shadowed NPs, and then I shadowed PAs as well. And when I did shadow the PA, I was like, it was a cardiology PA. And at this point I was like not super interested in cardiology anymore. So I did find, just because, I don't know, cardiology isn't my favorite, I found it to be like kind of meh. And so I was like, I think I definitely want to do MD. Just after shadowing all those.
Yeah.
And then just like all the positive affirmations after. And then obviously now we're at a point where I'm kind of not considering, but in between on like what I really want to do.
Yeah. I feel like this is the first time where we're at different points.
Yes.
Because you're considering, and after we graduated, I started working as an ER tech. And I was able to see doctors and PAs working in the exact same setting and their different roles on a team. And I just feel like I aligned more with what the PAs do in the healthcare setting. And then I think it made me realize when I'm shadowing and I'm making this decision, I need to shadow a doctor who's in a specialty and then a PA who's in that exact same specialty, because it's hard to compare when you're doing different ones. But what I like the most about PAs is the lateral mobility. Something to think about too is obviously we love emergency medicine. We're here. We love being EMTs. I could definitely see myself starting in emergency medicine, but it's on your feet. It's go, go, go all the time. What happens if I get injured? What happens when I age and I can't keep up with that lifestyle anymore?
Standing,
so I want to be able to have the career option of going into something that, might be a little bit more relaxed in terms of physically moving. I know you and me both, when it comes to spare free time, we love to travel.
Yes.
We love to travel.
Absolutely.
I think there was a kind of a point in my life where I realized that I wanted to work to live versus living to work.
Yes.
And as your friends get older and your friends go into these careers that you've been talking about your whole life, you see kind of like the sacrifices that they have to make, leaving weddings early, missing out on family events, missing out on things, which is great because they're passionate. And we need people like that in the healthcare field.
Absolutely.
But I knew personally, just being so close with my family, that was not something that I was willing or wanting to sacrifice if I didn't have to. So that was a big part in it. I know recently we've kind of been talking about my dad getting sick in the past couple of years, and you realize that you want to spend quality time with people, and I don't want the next 4 years of my life, 4 minimum, because of residency, to be tied down in a place that might not be anywhere near home. It's things you don't think about until you mature and you get a little bit older, and you say, maybe, medicine gives me a lot of passion. It makes me very, very happy. But traveling, it gives me more happiness and it makes me more excited. So I want to have time to do things that I wouldn't have time to do until I was in my 30s.
Exactly.
Yeah, which is very different for everyone. Everyone's different.
Everyone's path is different.
Yeah.
And I think just to touch back on undergrad real quick, I think one of the biggest things that we both found out was kind of just like the culture of pre-med. Yeah. Where it was like very comparison, very like, I do research here. Like, where do you do research? Like, someone asked us that, like, as we were waiting for class to start when we were taking the EMT classes. You forget to have, like, normal conversations. Exactly. And, like, the comparison thing, like, we realized very early on, very toxic to our mental health. And we kind of both were like, okay, we need to just get off that and kind of just focus on ourselves and not compare like, with each other or with anyone else. But to talk about my story a little bit, where I'm at, I'm in between MD and PA still. I recently, like a month ago, started studying for my MCAT, or a little bit more over a month ago. Started studying for my MCAT, did the diagnostic tests, and I did well in, and then I did the content review, and then I did a full length. But during this time, I was like really just kind of pressing on. Like, do I really want to do MD or do I want to do PA? Like just kind of like having this internal battle. And I thankfully did really well on my first full length test. And I was like, well, I know that I can definitely do, MD if I continue studying and then just, go ahead and take the MCAT. But at the same time, I was like kind of just cracking down on like the reasons why I wanted to be an MD. And a huge thing that I want to do, like in my life at least, is to go into the specialty of plastics. Like Chloe knows this from like day one. Like I've just been so interested in plastics. I've shadowed physicians. I haven't shadowed a PA yet in plastics, but I've like reached out and DM'd like plastics influencers, I've reached out on LinkedIn, like just asking questions to these PAs just to kind of like get a better feel of their scope of practice, and like kind of like looking to see if I could eventually shadow sometimes, so I can compare like the two roles and the scope of practices of a plastics physician and then a plastics PA. In addition to that, I think a big thing for me was like when, especially as you're going through school and like your family asks you like, oh, like what do you want to do and stuff.
Yes.
And like I'm sure you can relate, and you're like, oh, like right now I want to like pursue a field, like I want to be a physician, I want to go to med school, and I want to do plastics. And they're all just like hyped for you. They're like, oh my gosh,
a doctor in the family.
Exactly. Like for me at least, like it would be like one of the, like I'd be the first doctor in the family.
Yeah.
And like they just like, they give you that motivation, but at the same time, it's kind of like they hold an expectation over you. And I was like, I need to make sure that I'm doing this for the right reasons and not because my family.
Pressure.
Yes, exactly. I have that pressure where my family like expects me to be this.
Yeah.
So in that regard, there was that motivation, but seeing it now and just like coming more into terms and like seeing the different scope of practices, like you already mentioned, like I'm such a huge fan of traveling. I travel a ton, and I do love that. And I spoke to a lot of our friends, other friends that are already in med school that already are in their residency. I've spoken to like plastics residents and stuff, and like just hearing the amount of sacrifice that they had to give, and like missing weddings, missing like just huge family events and stuff. I am kind of just like focused more on like spending time with people and like that quality time, and like I don't want to miss out on these things because like we only have one life, and like there's so many things going on in this world, like who knows like what can happen the next day. So like I'm putting such an emphasis on like making sure that like I'm going into like either PA or MD because I'm willing to sacrifice that time. Like being a plastics, like going into plastics, I'd have to be a gunner off the bat, 4 years, for the 4 years, do well in medical school, have a bunch of research, and then on top of that, do 7 years of residency before I then become an attending or do a fellowship. And then it's just
never ending.
It's never ending. And so that's a lot of time. And I am at the point where I don't know if I'm willing to commit that time just because I'm going to have to miss out on so many things involved with my family. And I'm such a huge family person. And there's that point. And to be honest, like I've shadowed other PAs other than like cardiology, and they are significantly happier. They tell me like they would do this over and over again. Whereas doctors, on the other hand, a lot of them that I've spoken to are like, oh, I wouldn't have my kids do this, or I wouldn't do this track again. And that's kind of like disheartening. I don't know if you've
and not to say that that's true for all physicians.
Yes.
I know I work with so many physicians who are so passionate about what they do, and they say they would do it for $5 an hour if they had to. But yeah, I have kind of noticed that too. And I guess another thing that kind of came down to the decision, which is kind of, I feel like it's taboo for some people to talk about, or they feel kind of uncomfortable, but it plays a role into the decision. You kind of mentioned it earlier, is the doctor title.
Yes.
It's like, are you willing to give that up?
Exactly.
You were just picturing, being Dr. Diego Guzman for the past how many ever years of your life. And obviously physicians are seen with such high regard. And I don't know if you've been seeing this too, but even on social media, when PAs tend to post more content and you like go through the comments, you have all these people that have no idea what PAs are, what they do. They don't know the scope but you're not a doctor, you're an assistant, you're just giving advice, it's unsolicited. But I feel like the culture's changing, and that's like a whole nother conversation
that is
for another time. But yeah, I definitely have seen, at least in my last few months working in the ER, people are becoming a lot more receptive to PAs as a primary provider, more than they did even just a couple years ago. So that's good. It's good to see that. I think PAs are very vital to help take some load off of the doctors' backs. But yeah, I think no matter what path you decide to choose, there's great opportunities in both. I think it's just really a matter of what aligns with your values and your goals and your lifestyle.
It's really just like looking inward and like just seeing like which kind of path is most important.
Yeah.
Oh, one big thing though that is definitely kind of like swaying me more to the PA side is insurance.
Yes. Nobody talks
about insurance.
Nobody tells you that when you're a doctor, you have to pay for like malpractice insurance.
Yes. And they're in so much debt, and then you're on top of that have to pay for insurance.
Yes.
So it's just like paying that back is crazy. And then like I've known doctors that like have gotten sued for like just crazy things, and like just having to go through that with time and like with like an attorney and stuff like that. Like I'm fully okay with just like not having to deal with all that like logistics and the law part of being a physician, because it's super expensive, and on top of that you're at more risk. And I'm like perfectly okay with like kind of like checking over my work, if anything, like with a doctor and stuff, and like being like sitting at like a first-hand role, you know?
Like an assist kind of role.
Exactly.
Yeah.
So like there's just so much to consider.
Well, it really depends on the setting, if it's hospital versus private practice, but I think the biggest difference I've noticed is if you're okay not taking on the most complex cases all the time. If it's a private practice, it's kind of, I feel like everybody works together, but in a hospital setting, in the ER, at least what I've seen is when you have these patients coming in, especially at a teaching hospital, which is where I work at, that have more complex problems going on, the residents usually oversee those patients versus the PA kind of takes on the less complex cases, which is, it doesn't apply everywhere, but it's definitely something that you have to be okay with if you choose the PA route.
100%. And I mean, we'll see where I decide.
Stay tuned.
I know. I'm literally starting like the application process for like both, and I'm like, I have to make a decision sooner rather than later. Yeah. So, but I just love the traveling aspect. So we will see.
Jago wants to travel the world and not get sued.
Exactly. Like, that's all a man can ask for. That's all you can dream. Yeah.
Yeah.
But yeah, I think
that wraps it up.
Thank you guys for joining. I'm once again Diego.
I'm Chloe.
Make sure you subscribe, like, follow, whatever.
You've been waiting your whole life to say that.
Yes, literally. But yeah, thank you guys for joining us.